Hi, my name is Abigail Williams, and this is my final presentation, Beyond the Norm of Western Medicine, a Research Project. I'm a second-year biology major, and I'm on the pre-physician's assistant track at the University of Florida. My project is basically about disease causation and the two different types, as well as different complementary and alternative medicine trends that are seen globally. I really took a biocultural approach to this presentation as I looked at all the different factors that contribute to this research. I also was able to look at cross-cultural analyses in my different literature reviews. One source that was really useful to me was the George A. Smathers database online from the University of Florida. With this, I was able to find many scientific articles that I could use as credible sources for my research project. This brings me to my research question, which is, what are the fundamental differences between natural and supernatural causation of disease, as well as what patterns of disease causation and treatment are reflected across the globe? Here I have the bottom line, and that bottom line is that we can't begin to research treatment until we really understand causation. George M. Foster was a professor at the University of California at Berkeley, and he wrote an article that really focused on this concept. He said that before we can even begin to treat or diagnose people, we must understand the underlying cause of disease, and there are two different types of disease causation. Based on my literature review of the textbook that we have in this class by Wiley and Allen, as well as my literature review of Foster's article, I found the two categories of causation, one being natural and the other being supernatural. Foster gives us two different terms that can be used interchangeably, and those are personalistic and naturalistic. Now, all of these authors agree that they may exist as two in one. And what that means is, even in populations such as the Native Americans, who traditionally believe in supernatural causation and healing practices, can still utilize natural medicine in certain ailments. For example, for the Native Americans, if someone has a fractured bone or a broken bone or a bruise or a cut, even this tribe or population that may be used to supernatural healing and supernatural disease causation, they may use and utilize these natural healing practices based on these ailments because they know that they are useful and they will work in these situations. As we see by that Native American example, disease etiology is very much culture bound, and that brings us to this term called culture bound syndromes. And this term was coined by two MDs, Ruth E. Levine and Albert C. Gaw. And they wrote a whole article about these culture-bound syndromes, and the whole scientific definition is on the screen. But basically, these syndromes are illnesses that are very localized, and they are categorized by different coherent meanings from a particular culture. An example of a culture-bound syndrome is the Pibloktok syndrome, and it's found among the Arctic and subarctic Eskimos. It's categorized by abrupt episodes of extreme excitement followed by apparent seizures and transient coma. Victims have extremely erratic behavior, ranging from eating of feces to tearing off clothes to breaking furniture and the like. This disorder is in a category of atypical dissociative disorders. As promised, I took a biocultural approach in this presentation, so now I'm going to focus on social epidemiology. And Nancy Krieger is an author who really addressed theories about social epidemiology as well as social inequalities in relation to disease. On the screen here, I have a graph that I found in an article by the CDC, and as you can see, the number of healthy days of a population is greatly responsive to the income of that particular group. Now, these trends here shown are of the United States, however, these patterns are seen globally as well. This graph brings us to the concept of deprivation versus privilege based on social inequalities. These social injustices really put populations at greater risk to illness. They have a less easy time getting health care and access to doctors and treatments and such things like these, and it really puts them at a greater risk of illness. Krieger also, in her article, focused on different theories of social epidemiology, one of those being the psychosocial theory. Psychosocial theory is definitely a key point in the holistic approach to disease prevention because it helps us understand something outside of the norm as a way to intervene to reduce disease. And basically, the question that's trying to be answered here is why not all people exposed to germs become infected, even if they're in the same population and they're being exposed to the same pathogens. John Castle tries to answer this question based on a social approach and his conclusions on host resistance. He says that the most viable and promising intervention is to reduce disease by improving and strengthening the social supports rather than reduce exposure to stressors. Now that we've touched on these different causes of disease, let's focus on treatment of disease. First, I'm going to distinguish really quickly between traditional medicine and Western medicine. One major difference is concerning how people become healers. In Western biomedicine, someone goes through a white coat ceremony and they become a doctor or a nurse or a therapist, among others. Whereas in traditional medicine, someone is recognized and legitimized by other members in their specific culture. For example, among the Mayan Zimcanteco of the state of Chiapas in southwest Mexico, a healer is traditionally recognized by visitation during a dream. Another difference is biomedicine is typically evidence-based, while traditional medicine may come from a variety of traditions, folk tales, rituals, and the like. This graph is just an example of how recognition really rose in the past for complementary medicine, and it is a little bit outdated, but it shows that by 1997, the percentage of medical schools in the UK really grew to new heights in terms of offering courses or planning to offer courses of complementary medicine. And it really goes to show that even now, it's still on the rise in terms of people recognizing the benefits of traditional medicine. That brings me to the prevalence and patterns that we see today. Dr. Balbir S. Tomar claims that traditional medicines are not simply a thing of the past. He says that most countries have some form of a traditional system of medicine. He goes so far to say that as high as 90% of the populations in other countries have some form of traditional medicine. He also touches on the fact that the complementary and alternative medicine leaders in the globe today are China and India. They have traditional Chinese medicine as well as Ayurveda, which are two widely practiced traditional medicines in the globe today, but especially in China and India. A few other examples that are seen worldwide are in Cambodia, Nigeria, and Lao People's Democratic Republic. In Cambodia, a study by Cambodia Development Research Institute found that in different households, many different people were utilizing traditional medicine. But the thing that's so important is many of the users were without universal health care. And that'll become very important in my slides about conclusions here in a minute. The second one was a study done by Australian Journal of Medical Herbalism, and it was a 5-month research study in Nigeria, and it found that abundance of traditional phytomedical knowledge was preserved by oral traditions in Nigeria. Lastly was a study done in the Lao People's Democratic Republic by a French researcher, Berenez, and his associates, and he found that in this country bordering Thailand, people were actually eating insects for their medical benefits as well as the nutrients that they got from this practice. Some quick conclusions about epidemiology is that trends branch from all of these biocultural factors, and they all play a part and can put populations more or less at risk. And like I said earlier, the bottom line is one must understand causation to determine treatment. This brings me to my conclusion and implications on treatment. And I really just want to point out that complementary and alternative medicine is on the rise. Trends show global impact are largely focused on low income, and that's really the takeaway here. That traditional medicine gives hope to poverty-stricken and rural populations that wouldn't otherwise get any type of treatment or get healthy because they don't have access to this healthcare. Above all, what we really need to do is preserve these methods because they are truly beneficial to those who utilize them. Even here in the US, people using acupuncture and chiropractics, and how these traditional systems really help. They're widely tradition-based and regulated, so preservation is so important for these people who have these traditions and how important they are to their cultures. And here are my image credits. Thank you for watching.